Hello, I'm Carolyn Murray. It's important for women to see their doctor for a yearly exam to rule out a variety of health concerns, including reproductive cancers. Dr. Holly Thacker is a women's health expert who says the Pap test is the gold standard in cervical cancer screening, but recent research shows both providers and patients can do a better job following recommendations.
A lot of women are overscreened, which causes more cost and potential false positives. And a lot of women are underscreened or have abnormal Paps but don't do the follow-up.
A Pap test is one of the most reliable and effective cancer screenings. It can find precancerous changes on the cervix that can be treated before cancer develops or early cancer when it's most treatable. Some women need a Pap test every 3 years, while others older than 30 who've tested negative for the human papillomavirus or HPV and HIV can go every 5 years. Dr. Thacker says some women confuse a pelvic exam and a Pap test, but it's important to note the difference and to make sure that your provider is adhering to the appropriate guidelines. A Pap test is done with a small brush that collects cells from the cervix. A pelvic exam, on the other hand, is where a doctor feels for abnormalities. When you have a Pap, make sure that you get those results. If the results are abnormal, follow up for additional testing. All women are at risk for gynecologic cancer, so whether you need a Pap or not, Dr. Thacker urges you to see your doctor every year.
It's very important to not just only focus on the pelvis and the Paps. It's important to realize that the Pap is a screen for cervical cancer, not for ovarian cancer or uterine cancer. There are other health concerns all women need to be concerned about.
Symptoms of gynecological cancers vary, so it's important to pay attention to your body and know what's normal for you even when you have those regular gynecological exams. And be sure to call your doctor if you notice any unusual signs or symptoms. For News 2, I'm Carolyn Murray.